I'm Chelsea, and I'm the narrator. Our group is the COPD group. We have Mitch playing a doctor, Corell playing our patient, Donnie playing our nurse, Julia playing our family member, and Nikki as our respiratory therapist. Our setting takes place at an Indianapolis hospital. Our patient is Gretchen Kraus, and she is a 67-year-old female from Germany who has recently been diagnosed with chronic obstructive pulmonary disease. She currently has stage 2 COPD and is a heavy smoker. She is in the hospital, and we will be learning how to adjust to her new diagnosis and how to manage symptoms. She is here with a family member.
Hi, Ms. Krause. My name is Dr. Haverstall. I was talking to the nurses, and they told me you came in for a COPD exasperation. Can you tell me exactly what you were feeling?
Well, I've just been more tired, and sometimes when I cough, there's been mucus that comes up with it, and just like a tightness in my chest.
Okay. And is this happening just while you're doing your daily activities or while you're exercising? Can you tell me when exactly it is?
Mostly just when I'm doing things.
When you're doing things. Okay. Sounds great. So when you came in, we did a forced expiratory volume, and that's going to be how much air we can push out within 1 second compared to your expected outcome. And you're at 70%, which is significantly lower than you were first diagnosed with COPD. So with this and your exasperations, we're going to have to say you're moving up to COPD stage 2. And that just means you're having less elasticity in your lung tissue. So we're not able to actually push that air out as efficiently as we were before. You're also probably having more goblet cell production, and that creates the mucus that we're seeing in your bronchioles. So that's also going to make it a little bit harder to breathe. So you're on a short-acting bronchodilator right now, your inhaler. And what we're going to do is we're going to add a long-acting. It's going to be salmeterol. And this is basically just going to help you in the long run, just so we don't have to resort to that short-acting after you're having the symptoms. The long-acting should help you before that. Basically, I can have the pharmacist, and he'll write out how to take it. You're going to take it just like your other one. We're going to take it pretty much every day at the same time. As well as that, we're going to add some rehabilitation to your therapeutic program. We're going to do some upper body exercises. Now, you can do this if you're at a gym or your home. You can even grab like some cans of soup, just curl them. You can do some military presses. That's just going to increase your muscle tone, increase your lung volume. And walking 15 to 30 minutes a day. You can do this outside, or you two can go to the mall. What's your relationship?
My sister.
Your sister, yeah. So you guys can go to the mall downtown, do some shopping, something like that. So, any other questions that you guys had for me?
What time to do is the best to do exercise for her?
Don't do it like an hour before meals. I would wait an hour before your meal, have your meal, wait another hour, then maybe go out and do your exercise. So maybe sometimes after lunch, or if you're an early riser, you could do it early morning before breakfast. Yeah. So, anything else?
That's good.
All right, yeah. Well, I'm sure the nurse will be in here in just a few minutes for you guys, all right?
Thank you.
Awesome,
Thank you.
yeah.
Honey,
Hello. How you guys doing today?
good.
I'm Donnie. I'm going to be your nurse today, okay? And how are you guys related?
Oh, she's my sister.
Oh, okay. That's great. Well, I'm just going to talk to you today about the possibility of smoking cessation. Now, do you have a history of smoking?
Yes.
You do, okay. Well, what I wanted to tell you was that smoking is the greatest contributor to COPD, which is your diagnosis. It causes inflammation of your airways, which can cause difficulty breathing, and it also can cause hardening of the alveolar, which are the sacs that help get oxygen to your blood, so that your blood can carry oxygen to the rest of your body. So would you have any interest in maybe trying to cessate smoking?
No,
No?
because my mom has always been a smoker and nothing really happened to her, so I don't really think I should have to stop.
Okay, well, I want you to be aware that if you don't cessate smoking, your disease process will only get worse. Your symptoms, all that stuff is only going to get worse. It can only get better if you stop smoking, okay? I'm going to ask you one more time. Do you have any interest in quitting?
Maybe I'll think about it.
Okay. I'll go ahead and go get some information on some helpful resources you could use. And then I'll maybe have the doctor come in and talk to you about a nicotine patch or something like that. Does that sound good? Do you have any questions?
I think if she wants, we will discuss that.
Okay, great. And then I also want to talk to you about nutrition. It's very important with COPD that you have high protein, high calorie diet. It's important that you're drinking at least 3 liters of water a day. Small frequent meals are also important, and drinking between meals so as not to fill yourself up too quick. That can cause some difficulty with breathing.
Okay.
Yep.
Good.
Does that all sound good?
Mm-hmm.
All right. Well, I'll see you guys later. I'll be in a little bit, okay?
Thank you.
Hi Gretchen, my name's Nikki. I'm the respiratory therapist coming to work with you today. And who's this?
I'm her sister.
Okay, nice to meet you.
Nice to meet you.
So the first thing that I wanted to teach you was the pursed lip breathing. So do you ever have like shortness of breath? You just feel like you can't really get deep breaths?
Yeah.
Yeah, so this would be a good technique to use. It promotes that deep breathing, and you can use it whenever those times you feel that shortness of breath. So to do this, you just exhale through your pursed lips, so it's like when you're blowing bubbles, and then you inhale with your nose, through your nose with your mouth closed. So would you like to try it one time? Maybe see if we can do it.
So I breathe in through my nose and then blow out
Yep.
slowly.
Yep, so with your mouth closed, you breathe in through your nose, take a big deep breath, and then you blow out through the pursed lips like you're blowing a bubble.
Can you demonstrate it to her?
Yeah, so you just close your mouth and just take a deep breath. Yep, just like that. So that'll help you to promote that deep breathing and shortness of breath. So you can use that whenever you feel like you need to just get that a good breath. So the next thing I have is an incentive spirometer. So with this device, it measures how deeply you can inhale, and it helps you take slow, deep breaths to expand and fill your lungs with air. So to use this, you inhale slowly and deeply through the mouthpiece to raise the indicator. So when you cannot inhale any longer, you remove the mouthpiece and breathe and hold your breath, for about 3 seconds after, and then you can just exhale.
Hold 3 seconds.
Mm-hmm. And then, so with this, you should probably use it each morning to see where you're at, and then also after your medications to make sure that your medications are working. So the number should increase after those medications are administered. Do you have any other questions for me? No? All right, well, I'm sure your nurse will be back in if you have any other questions. You have a good day.
Thank you.